My name is Dr. Ryan Chowdhury. Today I wanted to talk to you about adenoidectomy. You should review the video that we have for tonsils, as well as often the surgical procedures go hand in hand, and often tonsils and adenoids are done together. So the first thing about adenoids is, what are they? Well, you can think of adenoids as simply tonsillar tissue at the back of the nose. They're exactly the same, and their function is the same. They're part of your immune system. The idea is when you breathe in through your nose, things in the environment will pass by the adenoids, and the body can form an immune response if it's needed. So if there's a cold and you breathe it in, it'll go to your adenoids, and then the adenoids will make antibodies against the cold. Anyways, in some patients though, the adenoids can become problematic. Most of the problems that we see with the adenoids is that they're too big. If the adenoids are too big, you're going to have trouble breathing through your nose. In children, this may lead to mouth breathing, snoring, and then if things are bad enough, even cause sleep apnea. Sleep apnea is where you have a drop in oxygenation level as you're sleeping, and short episodes of not breathing at all. Usually the patient will be snoring and then have short episodes of complete cessation of breathing. If you're sleeping like that, obviously you're going to have issues during the day in terms of behavioral problems or ability to concentrate or taking more frequent naps, or in kids even hyperactivity. So breathing through the nose is perhaps the most important problem that we see with big adenoids. There are other things as well. The eustachian tube, this is the tube which connects the ear to the nose. It's the tube that regulates pressure in the ears. When you fly, it's the eustachian tube that's opening and closing. If it doesn't open that well, you get pressure in your ears and it can be quite painful. Well, if you have big adenoids, it can block the eustachian tube, so you can get problems with the ears in terms of pressure, problems with ear infections, or even problems with fluid in your ears. So that's another major category that we take out the adenoids for. So the first is breathing through your nose. The second is problems with the ears. If you have allergies, the adenoids may respond to that, become big, and again cause problems with nasal breathing. There are a whole host of other problems you can get with your adenoids. If you think about, like, if you're nasally congested and your voice sounds nasally, well, that could be due to your adenoids as well. So now that we briefly talked about why you have adenoids and why they might need to come out, let's talk about what you can expect. Well, adenoidectomy is done in the operating room. I don't want to minimize it as an operation. It's a real operation that requires general anesthesia, and it has real complications. Usually things go just fine, but in small instances we can have problems. I think the biggest problem with the adenoids is the bleeding risk. It's pretty small, I'd say less than 1%. But in some children and some adults, after you've taken out the adenoids, that area at the back of the nose may not heal properly, and you can get bleeding later on. That bleeding can happen in a 2-week period after the operation. Usually it stops without us doing anything, but in very rare instances we do have to take people back to the operating room to cauterize the area. So that's number one, and probably the most important one you need to know about. The second one has to do with pain. Just like when we're taking out your tonsils, you're going to get pain. Taking out the adenoids can cause pain as well. Fortunately, it's pretty minor. Kids usually don't complain. I haven't had any adults complain either. I think the pain is something that can easily be controlled with Tylenol or Advil, but it is something to remember. If you're having the tonsils and adenoids being done at the same time, then the tonsils are going to hurt way more than the adenoids will. The adenoids do play an important function of filling the space at the back of the nose. When we swallow, the soft part at the back of the mouth rises and closes off the nose. If that didn't happen, food would go from the mouth and out through the nose. Well, you can get that if you take out too much of the adenoids. We call that velopharyngeal insufficiency, or VPI. It's a very rare complication. I've never seen it, and none of my colleagues have either, but it is something that can happen, so it's something to be aware of. Fortunately, with speech-language therapy, if kids are suffering from VPI following adenoidectomy, it can be repaired. There are some other complications that we'll briefly go over. Of course, the adenoid bed can get infected. If that happens, you get treated with antibiotics. You may notice it as a foul smell in your nose or as bad breath. Like with any operation, you can get chronic pain. That's pretty rare, but it can happen. And probably the last one I will tell you about is a problem that occurs when too much of the adenoids are taken out. The adenoids sit just in front of the neck vertebrae and the musculature there. So if some of that musculature gets burned during an adenoidectomy, it can cause some pain in that region, and it can cause some stiffness. Again, it's a very rare complication that has been reported in children, but fortunately we rarely see it, and I've never seen any episodes of it, and neither have my colleagues. Some of the other minor risks are when we are taking out your adenoids, we are working through the mouth, so there's a minor risk to your lips and to your teeth. Usually that's not a major issue. Even if we did damage them, they usually heal on their own. I think that gives you a pretty broad idea of what adenoidectomy involves and the different complications that you should be aware of. Keep in mind that usually things go just fine, a lot easier than tonsils. If you are having adenoid done separately, usually you can go back to work in a few days. For children, probably less than a week off. I hope that's helpful. Thank you very much.